Thank you, John. I did not include me playing the flute in my bio, but thanks for adding that in there and letting everybody know that. That made me laugh. Hello, everybody. Like John said, I am a certified athletic trainer, actually now of 14 years. And my goal with the band, with any other sports team that I've worked with, is to ensure the health and safety of all participants on the field, on the court, including, bystanders, the coaches, the staff, everyone. So today I'm going to be talking about weather and heat dangers. Not necessarily glamorous topics, but I think they're ones that we should all remember and review, because at the end of the day, we're really responsible for our group that's out there, and we need to ensure their health and safety at all times. Okay, so I actually have a PowerPoint presentation that I'm going to begin and share with you. And again, like John said, please, if you have questions, you can write them in the comments. And we will get started. Okay, so the topics that I'll first cover are one, knowing your emergency action plan, okay? We abbreviate that EAP. The second thing we'll cover are weather considerations, and lastly, the topic of heat-related illnesses. So the first topic, knowing your emergency action plan, okay? You may be asking yourself, what is an emergency action plan? What does it include? Okay. An EAP lists specific information, and it includes, number one, the names and locations, including addresses of buildings, venues, maybe even the field where you're practicing. Okay. Important asterisk there is to note that the field that you may be practicing at may actually have a different address than the school, venue, or building nearby. Okay, so I encourage you to find that information out. Second, EAPs typically include a list of potential equipment, for example, an AED, and their locations. Next, they also include a plan of communication to emergency medical services. Who's going to make that phone call? Lastly, it also includes the names, address, phone numbers of the nearest hospital, the nearest urgent care center. Those things should all be included in the emergency action plan. So you may be asking, well, who has this plan? Is it already developed? Okay, so I would encourage you to ask to obtain a copy of your site emergency action plan, either from your school administration or perhaps your school's athletic trainer. Okay, if you do have a school athletic trainer, they should have a specific EAP for every building, every venue, every field on your campus or on your setting. Or ask your administrator if you don't have a school athletic trainer. Lastly, part of this EAP also includes knowing any codes, meaning maybe there's locks on gates, a master lock with a code, how to open it. Or maybe you should obtain or request to obtain copies of keys to any lock gates, okay? We want to look at the gates around our fields and think about what may restrict access for an ambulance to get to your location, okay? We should know those codes, obtain or request copies of keys, so we have that information on hand that we can make access to that individual in need as fast as possible. So here's an example of the Campbell Sports Medicine EAP for the football and lacrosse practice fields, okay? EAPs can look different depending on your school. Some can be very lengthy and include, on the second page here, Campbell includes their lightning policy, okay, as well. But all in all, it has all the important information. It has the address, it has what personnel are on site. It includes important phone numbers, again, the location of emergency equipment such as AEDs, and the role of the first responder. Okay, when they call EMS, what are they going to do? They're going to provide their name, address, phone number, the number of individuals that are involved, their condition, okay, and any other information that's requested. All right, so here's an example of the EAP for the football and lacrosse practice fields. However, the EAP for the actual football field, okay, the main football turf field is different than this one, okay, has a different map, and an ambulance would enter that field differently than they would the practice fields. So important to know your EAP for the sites that you are using. Next, I will be talking about weather-related considerations, first being lightning. Okay, so the saying goes, when you hear it, clear it. When you see it, flee it. All right, our key points to remember here. You always want to review your school's policies or reference the NCAA or high school athletic administration guidelines. Another key phrase here is half an hour since the thunder roars, now it's safe to go outdoors. We call this the 30-minute rule. So if thunder is heard or lightning is seen, you are to suspend activity for at least 30 minutes and vacate all outdoor areas to a designated safe location. Safe locations could be a building, a bus. Maybe there's no building close by and all the members have to go into cars, okay? But safe locations include buildings, buses, and cars. The next part of the 30-minute rule includes if there's any subsequent thunder or lightning after the beginning of the 30-minute count, that actually resets the clock, okay? So that clock is reset and you have to start over and another 30-minute period begins, okay? Many high schools, many colleges do have devices. We have mobile phone apps for weather as well that we have access to where you can detect lightning and detect its proximity to your location. So if using one of these, you want to suspend activity if lightning is within 10 miles of your field or of your facility, okay? However, it's important to keep in mind that you always want to consider the reliability of these devices, okay? And therefore, hearing the thunder or seeing lightning should always take precedence over the information generated from devices or apps, okay? So even if the device says that it's 11 miles away, but you hear thunder or see lightning, that should always take precedence and you should always act upon it. Now, lightning injuries and lightning strikes, they are rare to happen. However, in the event that they do, of course, you're gonna call 911. You're next gonna initiate your emergency action plan, hopefully that you've obtained a copy of. Again, you've obtained the codes to any locks on gates. You've obtained copies of keys to any lock gates. And lastly, if you're CPR certified, you want to perform CPR immediately on the individual if no pulse is detected until that AED arrives. Here is the example of the North Carolina High School Athletic Association guidelines, okay? Again, you wanna make sure you're abiding by the policy of your school, your state, your governing organization. Again, if you have a school athletic trainer, they're gonna be your best resource for this information to go to. Next, I want to change topics here and talk about heat-related illness, okay? For those that are in North Carolina right now during the summer, it is hot and humid, and this is actually going to be a key topic that I talk about with all members of our band and color guard as we approach band camp this summer. So first, what is heat-related illness? Heat-related illnesses occur when there is an increase in the core body temperature above healthy levels. That increased core body temperature results in a few different things that happen in the body. First, it involves a decreased ability of the body to maintain normal functioning. Next, it also causes a release of inflammatory agents in our body. That could damage the liver, organs, muscles, and can ultimately lead to death if gone very far, if severe. There are many risk factors for heat-related illnesses. As you can see in this picture here, they include high temperature and humidity, direct sun exposure, indoor radiant heat sources, limited air movement, the individual not consuming enough fluids, physical exertion, the clothing that they're wearing, uniforms, the individual's physical condition and maybe health problems if they have a medical history, medications they're taking, if a female and pregnant, lack of recent exposure to the heat, and also advanced age. And lastly, if they have a history of previous heat-related illnesses, that's going to be another risk factor. So there are 6 main types of heat-related illness. They include heat stroke, heat exhaustion, heat cramps, heat syncope, heat rash, and rhabdomyolysis, okay? These heat-related illnesses, they differ in the signs and symptoms, okay? How the patient presents, how they feel, what they report, the onset, how quickly they occur, the severity, the treatment, and also they vary in the need for immediate medical attention. And we have to treat each of these situations differently and know how to recognize them. So the first being the difference between heat exhaustion and heat stroke, okay? You can see in this picture here, the typical signs and symptoms of both. In heat exhaustion, the person typically feels faint or dizzy. They have excessive sweating. They have cool, pale, clammy skin. They may be experiencing some nausea or vomiting. They have a rapid and weak pulse. And they may also be experiencing muscle cramps, okay? Medical professional, athletic trainer, EMT, the best way for us to diagnose and know if there is heat exhaustion versus heat stroke is to actually take a rectal temperature, okay? Heat exhaustion is considered a rectal temperature of less than 105 degrees Fahrenheit. Again, we need to be able to recognize these signs and symptoms of heat exhaustion. If that individual is experiencing them, we move them to a cooler, air-conditioned place. If that's not available, move them to the shade, under a tree, somewhere where they can get a break from the sun. We encourage them to drink water if they're fully conscious, and even maybe to take a cool shower or use cold compresses, ice bags, behind the neck, under the armpits, back of the knees. Those are all good areas to put ice bags. And we could just monitor this person. As long as they're not deteriorating, they're not feeling worse, they're not becoming incoherent in any way, we can monitor them, remove them from activity, and as they get better, we may or may not be able to return them to activity that same day, but we're able to monitor them without really serious medical intervention. However, during heat stroke, that's a whole different scenario, okay? Heat stroke is considered a rectal temperature greater than 105 degrees. You could see here that the signs and symptoms of this heat illness are very different than heat exhaustion, okay? The person may be experiencing a throbbing headache with no sweat, okay? It's the absence of sweat. Again, they may be experiencing nausea or vomiting. Instead, they have a rapid and strong pulse. And in some scenarios, they actually may lose consciousness, okay? Treatment for heat stroke is to call 911 immediately, okay? We need to take immediate action to cool the person until help arrives, okay? At our band camp, we actually will have 2 inflatable pools filled with ice and water that we could submerge a person if needed, okay? That abbreviation down there under treatment, call 911, and CWI means cold water immersion, okay? We want to cool them as rapidly and quickly as possible by dunking them in cold water, ideally 35 to 55 degrees Fahrenheit. Now, if a pool is not available to you and that's not possible, you want to just continually and aggressively be dousing them with cold water, okay? We need to, in any means necessary, get their body temperature down while waiting for help to arrive. But as always, call 911 first. Okay, next up we have heat cramps and heat rash, okay? These are certainly more of the less severe things. But we do see these often, and as an athletic trainer, I will, I'm sure, see many people come to me complaining of these, okay? So it's important to be able to know them, recognize them, treat them, and hopefully educate the person enough that they can prevent them in the future. So heat cramps, what are they? They are immediate, occasionally progressing involuntary and hurtful muscle contractions. And they occur due to dehydration, a lack of electrolytes, fatigue, or a combination of all of those, okay? While a person is experiencing a heat cramp, which commonly occurs in the calf, arms, abdominals, muscles, even in the low back, they're often also excessively sweating, okay? The treatment for heat cramps is the person to rest, okay? So you want to remove them from practice or activity, have them cool down, again, in a shaded area or air-conditioned area if available. We want to provide fluids, either water, a sports drink, clear juice, if able, if possible. Next, you can perform gentle stretching of that involved muscle, even maybe some gentle massage of that muscle group. And you want to hold them from returning to any strenuous activity for several hours, okay, or longer after the heat cramps go away, all right? I will say from my experience with heat cramps, typically the people that it happens in often, they know it and they could feel it coming on. And once you hit that point of a full-on muscle cramp where the calf is completely contracted, despite the rest and cooling down and stretching and stuff, there's really not much more you can do to get them back onto the field, get them back in practice quickly. They really just need to rest and cool down and stretch and maybe just return for the next session or for the next day, because they just tend to repeat themselves. Another more minor heat-related illness is heat rash, okay? A heat rash is skin irritation caused by excessive sweating, which forms itchy and painful red pimple or blister clusters and skin lesions. It is exacerbated in hot and humid weather and common on the neck, chest, groin, armpits, elbow creases, and even behind the knees. If this occurs, it's really not a limiting factor for the person, as long as they could tolerate it, continuing to practice or continuing to participate, that's okay. I would just encourage them to have a cool shower as quickly as possible after their practice or after their activity, ideally with a non-drying soap. Acutely though, you can apply a cold compress or an ice bag to just kind of more reduced pain, reduce the inflammation. But we also want to educate the person on avoiding any lotions and creams, which may clog the pores. Okay, you want to give your skin the ability to breathe and for the rash to go away. Now, these last two types of heat illness, a little more severe than the last slide. They include heat syncope and rhabdomyolysis. Heat syncope, simply means fainting, okay? And that occurs in persons that can be characterized as out of shape or unacclimatized when they are subjected to heat for long periods of time. It's often caused by dehydration and typically appears in those first few days of abnormal heat exposure. So this could be something that we see in band camp this summer, especially due to the current climate with COVID, our quarantine, us being inside at home, not having much exposure to the heat. If we're seeing this, it usually occurs in those first few days. Treatment for heat syncope, you want to move the individual to a cooler, shaded area, have them lie down on their back and prop their feet up, okay? Elevating their feet will allow some blood to go back, centralize into their body, which will assist with returning their blood pressure to a normal level. We also want to provide them fluids, okay? Again, water, sports drink, clear juice. We can apply cold compresses, ice bags, again, to those key areas behind the neck, armpits, behind the knees, the groin. And as well, we want to be monitoring their vitals and monitoring their overall state. You know, if they deteriorate, then we want to seek medical attention for them. Okay, maybe get them to your school's athletic trainer, contact your health center, or refer them to maybe an urgent care center if nearby. And lastly, we have a condition called rhabdomyolysis. This is a relatively rare condition, but it is life-threatening, okay? This is a medical condition, and it's sometimes caused by heat stress and prolonged physical exertion. In this process, the muscle fibers actually rapidly break down. During this breakdown, they release electrolytes and proteins into the bloodstream. When left untreated, it can lead to kidney damage, seizures, irregular heart rhythms, and ultimately death, okay? Symptoms include muscle cramps, severe muscle pain, dark urine, weakness, inability or a decreased ability to perform physical exercise at the normally expected level or duration, and joint pain or stiffness. Treatment for this, similarly to heat stroke, is 911 and the nearest hospital or emergency room, okay? The telltale sign of rhabdomyolysis is that dark urine. They call it Coca-Cola urine. As you could see in this picture here, it's very dark. That is a sign, and that we need to refer this person immediately. Okay, again, it's a relatively rare condition, but it's something to be knowledgeable about. So prevention of heat-related illness. How do we prevent it? First, as always, we want to implement pre-participation screenings and physicals prior to activity in order to identify those that are an increased risk for heat illness, okay? We need to provide also an acclimatization period for these individuals for practicing. That could last 1 to 2 weeks. During this intensity and the length of activity or the length of your practice session should be gradually increased. Those diagnosed with a viral infection or other illness, they should not participate until the illness has ended, Okay, so anybody that reports any kind of sickness, illness, they should hold from activity because they are going to be more susceptible for heat-related illness. And then you'll have two problems on your hand. Next, you want to always encourage practicing good hydration habits. This includes proper replacement of fluids and nutrients following activity. And during activity, you want to make sure that you provide access to fluids at all times. We also want to encourage an adoption of a healthy lifestyle, greater than 7 hours of sleep each night, having a balanced diet, ensuring proper hydration, and rest times. We want to identify those that are predisposed to exertional heat and illness. We want to identify them. We want to know who they are, and we want to monitor them closely during these practices, especially during this extreme heat and humidity that we have currently in North Carolina. We also want to impose a lot of rest periods, okay, during practice. These breaks should happen in the shade with readily available fluids. And our activity plan, it should be based on what's called the WBGT, the wet bulb globe thermometer, and intensity. So here is a picture of one example of a WBGT unit in that upper left. And this is the athletic activity guidelines for the North Carolina High School Athletic Association, okay? This instrument is able to detect the relative humidity and air temperature. And these are the activity guidelines for athletics, for traditional sports. And again, these may, you're gonna keep this in mind that these are for sports, but you should take into consideration some of the things that they're telling you about how often rest breaks should occur and how long they should be. So if the WBGT index is less than 80, that allows for unlimited activity. You should allow a 5-minute water rest break every 30 minutes, okay? However, when that humidity and air temperature increase to the range of 80 to 84.9, you want to schedule mandatory rest and water breaks 5 minutes every 25 minutes. Again, moving on, if it's between 85 and 87.9, you want to implement a rest water break 5 minutes every 20 minutes of practice, okay? And again, we want to have, you should have access to an ice immersion pool, ice bags, okay? You should have that nearby or know where they are in case they're needed. The WBGT index is between 88 and 89.9. You should schedule our rest water breaks 5 minutes every 15 minutes, okay? And again, you want to make sure you have that ice immersion pool, cold water, ice bags, cold compresses available. And if the WBGT is 90 or above, okay, as far as athletics goes, practices are suspended and they must include mandatory breaks as directed if it's during a contest or game. Okay, so keep these things in mind. This gives us a little idea of how long and how often our break period should be during the heat, okay? At a minimum, you could see it should be 5 minutes every 30 minutes. That's at a minimum. Now, I did find this that I wanted to share with you all using that WBGT measures. And this is actually for the Valdosta State marching band, okay? So they actually have an in-place policy of their WBGT levels and therefore the actions that need to be taken place. If it's less than 82, they're allowed to wear full uniforms, okay? If it's between 82 and 86, it says full uniform should be worn no longer than 40 minutes, okay? Regular intervals where jackets and their hats are removed. If it's between 87 and 89, their full uniform should be worn no longer than 20 minutes. Less time is recommended based on physical exertion. Their jackets and hats should remain off for as long as possible. If it's between 90 and 92, they're there to wear what's called their summer uniform, okay? If it's greater than 92, their summer uniform will be worn during performances, okay? So this is actually taken from a university's marching band policy. So all good information here. I'd like to provide you some time to ask some questions. We could participate in a group discussion, whether on the heat, weather considerations, or anything else that comes to mind.
Katie, this is amazing what you're presenting. I had one that was kind of comical, but in serious in a way, and it was kind of a myth or a truth.
Okay.
Is there more danger? Is it true that there's more danger for those kids, you know, carrying a pole or a metal sousaphone opposed to a plastic clarinet when you're talking about weather conditions? So again,
in the event of lightning?
Yeah. So
well, it's not encouraged to be holding anything metal during lightning, or to, you know, a safe shelter is not on putting everybody on the stands, you know, metal stands at a field or under a tree. Those things should be avoided.
Okay. So we need more insurance for our tuba players than our clarinet players. Okay.
Correct.
Good point. Another question that came about is when we deal with health forms, and I know that can be blown up a lot more during our COVID situation right now than usual. But what are some key things that we should have on our health forms? Maybe, you know, especially because we have quite a diversity in our group here between young teachers and seasoned teachers and such like that. Notice I didn't say old. But, you know, what are some key things that we might have on our health form that we should be reminded of?
Sure.
Students, especially, which I thought was awesome, is your EAP discussion in the very front of your session.
Okay, here, I'm actually going to pull up ours and share them in a second here.
Okay. And I apologize if you did say something. There were some people who were coming in late who might have not
okay.
have.
That's okay.
Okay.
Okay, so let me share. Now this, you guys could see that?
Yes.
Yes, okay. Now this is the form that we're gonna be using for our band and color guard, okay? And this was taken from the American Academy of Pediatrics, and it's endorsed by many different health and medical organizations here at the bottom. The list in the fine print is very, very long. But this physical evaluation form, okay, is obviously it's performed by a medical doctor or DO, and includes their height, weight, vitals, blood pressure, pulse, vision, and a full medical and musculoskeletal exam, okay? At the end of the day, we want to ensure that our participants are physically capable, and they're not putting themselves at risk for any injury or condition, okay? So the medical screening that a physician would perform would include everything from examining their eyes, ears, nose, and throat, their heart, listening to their heart, listening to their lungs, abdomen, examining their skin, performing a neurological exam, their reflexes. And next up is the musculoskeletal exam, okay? Just like an athlete would go through, okay? We want to check all the main joints, how they function, the neck, shoulders, elbows, wrists, knees, and any presence of previous injury is really important here too. So this is the form that a physician would fill out. Now it depends on where you're working. They may have a set form at a high school for your athletic association may have a set form for you to use, for their athletes to use. That's totally up to that organization. But next, here is our health history form. And this is what a student would fill out prior to going to and bring with them to their physical. Okay, and this includes personal medical history as well as family medical history. Any past or current medical condition they list. Have you ever had surgery? Any current medicine, medications or supplements they're taking. Okay, this is also important talking about heat illness because many medications can be dehydrating and could increase your susceptibility to heat illness. Any allergies, that's very important to know as well. Allergies to medications, foods, insects, insect stings since we're outdoors. When you're looking through the medical forms, well, what I'll be doing when I look through the medical forms, I'm paying very close attention to these sections, okay? Anybody that's allergic to something, are taking medications, anybody that has a previous surgery, a medical condition, that answer yes to any of these questions about heat-related illness or susceptibility, I want to identify them. I want to know who they are, not just their name. I want to know what their face is, so that I could pay close attention to them during practices, you know, when we're outdoors. But this also includes questions about the heart, medical questions, some questions just for females only. But these are the forms that we will be using. I think they're very good. They answer all the necessary information. And at the end of the day, they're used to guide the physician in performing their physical and addressing any needs, worries of the person.
Another question that came up, and again, I think sometimes different districts and obviously age, especially, you know, being 18 and older or 17 and younger might come about. Can you maybe touch on some best practices that teachers could implement for students with carrying medications or inhalers to, you know, for especially our young teachers who, you know, need to do the right thing and not cross that line maybe.
Mm-hmm.
You know, maybe, you know, silly things like, you know, should they hold all these medications? Should students be sharing these medications? You know, things, you know, I know this, it's the obvious, but if you can touch on these
Sure.
best practices.
Well, certainly we don't want anybody to be sharing medications. That's first thing. They're always prescribed to the person. I would, if I were just a teacher or you know, a band instructor at a school or high school level or below, I would meet with your nurse, your school nurse, your school's athletic trainer, and talk to them about that. You also have to consider your comfort level with carrying those things and dispensing those things. Also, you need to then have a conversation. If they're a minor, obviously they're under age 18, you need to have a conversation with their parent, okay? It could be as simple as they're asthmatic, right? And they have an inhaler that's prescribed to them and they can't really carry that around with them while they're practicing. Well, that's not so much a big deal. You know, maybe they have a backup that you can hold or put in a bag when you travel, that you always have it with you, okay? You may feel comfortable doing that. If there are other more serious, you know, medications that they're relying on taking regularly or at certain intervals, again, I would just discuss that with your school nurse, school athletic trainer, and ultimately their parents.
Okay. Another question just came through. and the person asked, do you suggest students drink more water or sports drinks during practices? I know you being a fellow Gator are going to recommend Gatorade, or if you're on a Pepsi campus or a Coke campus, you know,
Right.
you have you required. But the question is, do you suggest students drink more water or sports drinks during,
Okay.
during being the key word they had during practices?
Now, water is often enough. Water is often enough. However, during hot, humid conditions, depending on the individual, may need more than just water. Okay. We do vary individual by individual. Okay. How much we sweat. Okay. I sweat like crazy. I drip, you know, some people don't. Okay. So how much you sweat, your tolerance. Okay. Some people may not be able to drink a sports drink during activity. It just upsets their stomach. So the key point is water is often enough, but during really hot, humid conditions that we're going to see, sometimes you do need to supplement with that with a sports drink. However, keep in mind that many sports drinks are also very high in sugar, their sugar content. Okay, so when you look at Gatorade, for example, they have now made the G2, okay, which is less sugar. Okay, it's a little easier on the stomach, and therefore it's a little more healthy alternative. Okay, so you also want to look at that in a sports drink, its sugar content. But all in all, water is often enough for most of us. However, in certain situations, the weather, your personal tolerance, your personal how fit you are, how acclimatized you are, you may need more than that.
And what if we took it to the food side, especially when, you know, for snacks, quick energy? We have some band directors, you know, that, you know, load them up on M&Ms before they go and perform, you know, to, you know, in essence, to give them more energy. Or, you know, to the other part of the spectrum of, you know, a snack to keep you going until you have that next meal. What are your recommendations from maybe the granola bar concept to sticking to fruits like bananas, apples?
Sure. We're actually gonna, you know, you had asked me to talk, we have meetings next week with all members of our band, and this is actually one of the topics I'll be speaking about is nutrition. So with nutrition, about 2 hours before your activity, you want to make sure you have a meal. And this is 2 hours before, okay? It's not 5 minutes before, okay? Because you never want to do activity out in the heat on a full empty stomach, okay? So it starts long before you actually participate. So 2 hours before, you want to have something that has some quality carbohydrates, lean protein, heart healthy fats, and also include your fluids. Okay, like I'm going to tell our band members, color guard members, this also does not mean any fried foods, any greasy foods, any spicy foods. Okay, you just picture yourself eating something like that going out in the heat, probably not going to feel that great. If they only had about 5 to 10 minutes to really get something quick, they woke up late, they're in a rush, you know, just eat a piece of fruit, an apple or a banana, you know, and then try and get another small snack, you know, about 30 minutes later. My go-to would be fruit during activity, granola bars, maybe not ones that are really heavy in like chocolate or caramel, those really rich items. That may cause some stomach discomfort. So you want to kind of stick to more plain things, essentially. Lots of fluids, plain things, fruit. Those are always good things to go to.
Excellent. We have about 3 more minutes to go. We had 2 more questions. One was, is it possible for you to provide a link to the PowerPoint that you had? I think there are a couple people that were interested not only in the EAP, but the uniform, and there were some really cool things that you were doing, and sometimes it kind of slid to the side. And we
Okay.
see, but I think there's some teachers who are interested. Uh,
Certainly.
and then the other one is just in the last couple minutes here, any last recommendations as we all have that thread that we're dealing with COVID? Maybe some recommendations, best practices that, and it's not going to hurt that we hear it throughout the 3 days and every
Yeah.
single day as we get to school. But in the last couple minutes, if you can make some recommendations.
Well, the best practices that we're hearing continually on TV from our governor, from higher up officials, is always good hygiene, washing your hands frequently, using hand sanitizer if you can't wash your hands, not touching your face excessively, wearing a face mask, of course, the social distancing, and just, practicing all of those things safely. It's an interesting time. This is, as an athletic trainer of 14 years, I've never experienced this either. And it's constantly changing, the recommendations, but those recommendations don't change. The hygiene and the wearing the mask and the social distancing and keeping yourself safe, that hasn't changed. But all in all, you need to go by your school's policies, your state's policies. And as long as you're abiding by that, practicing those simple measures, that's going to be the best way to protect yourself and to protect others.
Thank you so much. And to everybody out there, Katie has been a strategic person in our planning as we are preparing for our band camp to roll out in the next couple weeks. And we cannot encourage more to look into your own schools and you're working with your athletic departments and their athletic trainers to do the same. Katie has been beyond